Hi, this is the lecture presentation component for Unit 8, Management of the Patient with Musculoskeletal Disorders. This lecture is divided into 3 presentations. You can use them from week to week to focus your study efforts. They complement the material that's in your book. But with the lecture presented in this format, you'll be able to get the information at the time that's best for you to learn. You can pause, review anything that wasn't clear. You can take breaks when you need to. Take notes on anything that's not clear to you and bring your questions to class and we'll discuss them. There will be time allotted at the beginning of each class session to review any concepts that are difficult or unclear. So reading from your outline, the lesson objectives are to use the nursing process as a framework for the patient with musculoskeletal problems. You're going to plan care for the patient with a cast, plan care for the patient with traction, and that includes skeletal and skin traction. We'll plan care for the patient with an amputation. We'll plan care for the patient with internal fixation as well as external fixation devices. We'll plan care for the patient with a total hip arthroplasty and total knee arthroplasty. Plan care for the patient with a metabolic bone disorder with a focus on osteoporosis. We'll plan care for a patient with bone infection. And although it's not listed on your outline, your reading does go into osteoarthritis, which is one of the major causes of disability in the United States. So we will focus on that when we talk about the patient who has a total hip replacement or a total knee. The first presentation is going to focus on a brief overview of the content, and then we'll focus on caring for the patient with musculoskeletal trauma. It starts with soft tissue injury, strains, sprains, and contusions. We'll care for the patient who has a fracture, and we'll be talking about the different types of fractures. Care for the patient with a cast. Care for the patient with traction. Then we'll talk a little bit about external fixation devices and a little bit about internal fixation.